Approach to a patient with joint pain. Let's begin our approach using P3 MAFTOSA. 3 Ps. Present complaint, past complaints, personal history. Let's start with present complaints. Do you mind if I ask you what has brought you into hospital here, or how have the joint pains been affecting you? Can you please tell me more about it? Ask about pain questions using Socrates PDA site. Where exactly do you feel the pain most? Moreover, check, is the distribution of symptoms is mono-articular or polyarticular? The involvement of joints is in a symmetrical or asymmetrical pattern. Either large or small joints are mostly involved. Any signs of involvement of ligament or tendon insertions? Onset, how did the pain start? What were you doing when it started? Is it the first time or there were previous episodes? Determine, is it sudden or gradual in onset? How have the joint pains been affecting you? Character, can you please describe the pain for me? Next, ask about radiation. Does this pain go anywhere else? If the answer is yes, then ask where it goes. Associated symptom. Ask for any morning stiffness, joint pains, swelling, and deformity. Any restrictions in the range of movement of the spine, or any painful eyes, blurring vision, and ask, does the light hurt you? Let's ask about the details of these association. Firstly, check for the presence of joint pain in timing. Are they most painful first thing in the morning or later in the day? Pain due to inflammatory arthritis causes worsens in the mornings, whereas pain due to degenerative conditions progresses throughout the day. Swelling, do your joints swell? The presence of synovial swelling differentiates arthritis from arthralgia. Stiffness, do you feel your joints become stiff when you wake up in the mornings? How long does it take you to get them to be normal? Joint stiffness helps to differentiate inflammatory arthritis from degenerative conditions, as morning stiffness greater than 1 hour is typical associated with rheumatoid arthritis. 4. Rash, ask about, where is the skin lesion? When did you first notice the skin lesion? How does the skin lesion feel when you touch it? How many skin lesions are there? What shape are the skin lesions? As conditions that can cause joint pain and rash simultaneously include psoriasis for silvery scaly rash, systemic lupus erythematosus for malar rash, photosensitivity, alopecia is also a feature of SLE. Moreover, infections like rheumatic fever, Lyme disease, and viral exanthem can cause rash and joint pains as well. Next, ask about orogenital ulceration. Oral ulceration is associated with systemic lupus erythematosus, Behçet's disease, and reactive arthritis. Furthermore, eye symptoms, a red or painful eye may be a consequence of episcleritis or scleritis and rheumatoid arthritis, and dry, gritty eyes suggest keratoconjunctivitis sicca caused by Sjogren's syndrome. Next, ask about fever, weight loss, anorexia, and night sweats may be a clue to sepsis or severe connective tissue disease. Exacerbating factors, does anything make it worse? Further, ask about relieving factors, does anything make it better? Ask, have you tried any analgesics? Scale, if I was to give you a scale from 1 to 10, 1 is lowest and 10 is highest, how do you scale the pain? You may ask, does the pain keep you awake at night? Night pain suggests malignancy or very severe arthritis. Progression, has the pain changed over time? Is it the same, getting better, or worse? How is this pain different from previous episodes? Duration, how long it is present, as the pain lasting less than 6 weeks may be due to viral infection, whereas after 6 weeks rheumatoid arthritis is a more likely cause. Anything else? Before the start of questioning about specific diseases that might result in joint pain, let's have a quick look at the possible differentials. Septic arthritis presents an acute onset with mono-articular joint pain. The presence of constitutional symptoms such as fever, weight loss, and malaise will support the diagnosis. Osteoarthritis, joint involvement is asymmetrical, and typically affected joints are knee, hip, and spine. The distal interphalangeal joints and the first metacarpophalangeal joint at the base of the thumb are usually affected in the hands. Rheumatoid arthritis presents a symmetrical peripheral polyarthritis typically affecting the metacarpophalangeal and proximal interphalangeal joints of both hands. The shoulders, knees, and cervical spine are also commonly affected. Crystal arthritis, gout most commonly causes mono-arthritis affecting the first metatarsophalangeal joint, but may also affect the knees. whereas Pseudo-gout most commonly affects the knees and shoulders. Sero-negative arthritis is asymmetrical and involves large joints in the spine. They are also associated with enthesitis, or inflammation at tendon or ligament insertions, for example, Achilles tendinitis. Past complaints. Similar complaints. Has anything like this has happened to you? For how long? What did you take for it? Is it well controlled? Are you taking any medication? Ask for use of non-steroidal anti-inflammatory drugs, steroids, and disease-modifying agents. If yes, then ask for possible side effects. Do you have any long-time medical condition? If yes, then ask how long. Is it well controlled? Ask for previous fractures and orthopedic procedures. Ask about hospitalization, saying have you ever been hospitalized? If says yes, then ask what for example for any procedure like any biopsy. Next step is personal complaints. I'm going to ask you a few personal questions, and whatever you say will be confidential. Smoking. Do you smoke? If say yes, then ask, how many cigarettes do you smoke a day? For how long have you been smoking? Cigarette smoking is a risk factor for osteoporosis. Tell me about your sleep. Do you drink alcohol? If he says occasionally, leave it. If says yes, proceed by asking what do you prefer to drink? How much? For how long have you been drinking like this? Alcohol consumption is also an important risk factor for osteoporosis. How is your appetite? Recreational drugs. By any chance do you take recreation drugs? If says yes, then proceed by asking, sorry to ask you but what do you do? How do you take it? If injecting, ask, by any chance do you use a new needle all the time? For how long you are doing this? Do you use any other recreational drugs? Weight change. Have you been weighing on the higher side? If yes, ask about bowel habits. How often do you open your bowels? Have you noticed any change? Sexual history. Are you sexually active? If says no, then ask, have you ever been sexually active? If the patient is sexually active, then ask, sorry to ask you this but are you in a stable relationship? For how long? Are you on any contraception? Did you travel abroad before your symptoms? Did you have any sexual relationship there? If the patient is a woman, ask about 4P, period, LMP. When were your last periods? If more than 4 weeks, then she might be pregnant. How many days did they last? Are they irregular? Do you get paid? Any bleeding between your periods or after intercourse? Are you on pills? Pregnancy. If she is not active so she is not pregnant, then ask, have you ever been pregnant? Duration of pregnancy? Mode of delivery? How many children do you have? Any miscarriage or abortion? Any complications before, during, or after pregnancy? Pap smear. When did you have your last pap smear? What was the report? Was it normal? If it is abnormal, have you booked an appointment with GP? Allergy. Family history. For carcinoma, history in a family is important. Just ask. I am very sorry to ask, but if anyone in your family is diagnosed with a sinister disease, cancer, ask for osteoporosis, psoriasis, and ankylosing spondylitis, as well. Travel history. Occupation history. What do you do for a living? Ask about the nature of the work. Does it involve excessive use to joints that might be precipitating joint injury? For example, kneeling causing prepatellar bursitis, housemaid's knee, repetitive joint use causing tenosynovitis, or tennis elbow. Ask how much these symptoms are affecting your daily living, whether he has had to take time off from work due to pain. Social history. Where do you live? Whom do you live with? Inquire about the functional status of the patient, particularly the impact on the activities of daily living such as self-care, cooking, shopping, and driving. How much these joint pains are affecting you. Are you able to perform activities like washing, dressing, shopping, and cooking? Can you walk up and down stairs without difficulty? Ask about mobility, both within the home and driving outside. Are the joint pains affecting your relationship? Ask about the use of aids and appliances to assist with mobility and activities of daily living. Furthermore, offer social services support, if necessary. Anything else you want to tell me? Now, at the end, take your time for an impression. Then, turn to the examiner and say, based upon my history, my most probable diagnosis is this. My differentials are this, and that, and I should have ruled out this and that. Thank you for watching. Stay connected and subscribe to this channel for more interesting medical professional videos. And, Good luck with your exam.